A brain stroke, also known as a cerebrovascular accident, occurs when blood flow to the brain is interrupted, leading to the death of brain cells. Strokes can be caused by a number of factors, including a blood clot, a burst blood vessel, or a narrowing of the blood vessels in the brain. The effects of a stroke can vary depending on the severity of the damage and the part of the brain affected, but prompt medical attention is crucial to minimize the long-term effects of a stroke. In this video, we will explore the signs and symptoms of a stroke and what you should do if you or someone you know experiences them. The most common signs of a stroke include sudden weakness or numbness in the face, arm, or leg, especially on one side of the body. This is often accompanied by confusion, trouble speaking, or difficulty understanding others. Additionally, people with a stroke may experience a sudden loss of vision in one or both eyes or have trouble with coordination, balance, or walking. They may also experience a severe headache that comes on suddenly with no apparent cause. It is important to note that not all symptoms of a stroke are sudden or severe. Some people may experience only mild symptoms, such as a headache or difficulty with balance or coordination, which may be mistaken for other conditions. However, even mild symptoms should be taken seriously, as they can indicate that a stroke is occurring or that a person is at risk for a stroke. One way to remember the signs of a stroke is to use the acronym FAST, which stands for F. Face drooping. If one side of the face droops or feels numb, it may be a sign of a stroke. A. Arm weakness. If one arm is weak or numb, it may be a sign of a stroke. Ask the person to raise both arms. If one arm drifts downward, that arm may be weaker than the other. S. Speech difficulty. If the person has trouble speaking or understanding others, it may be a sign of a stroke. Ask the person to repeat a simple phrase. If they have trouble or if their speech is slurred or garbled, it may be a sign of a stroke. T. Time to call for help. If you or someone you know is experiencing any of these symptoms, it is important to call for emergency medical attention immediately. Other signs and symptoms of a stroke may include sudden dizziness, loss of balance or coordination, difficulty swallowing, or a sudden change in mental status. These symptoms can be particularly worrisome in older adults, who may be at greater risk for stroke due to other medical conditions. If you or someone you know is experiencing any of the signs or symptoms of a stroke, it is important to seek medical attention immediately. Prompt treatment can help to minimize the damage caused by a stroke and improve the chances of a full recovery. To diagnose a stroke, medical professionals will typically perform a series of tests, including a physical examination and imaging tests such as a CT scan or MRI. Depending on the severity of the stroke, treatment may include medication to dissolve blood clots, surgery to repair damaged blood vessels, or rehabilitation to help the person regain lost function. In addition to seeking medical attention, there are several steps you can take to reduce your risk of a stroke. These include maintaining a healthy diet and exercise regimen, quitting smoking, controlling high blood pressure and cholesterol, and managing other medical conditions such as diabetes or heart disease. In conclusion, a stroke is a serious medical emergency that requires prompt attention. The signs and symptoms of a stroke can vary depending on the severity of the damage and the part of the brain affected, but common symptoms include sudden weakness or numbness, confusion or difficulty speaking, loss of vision, and severe headaches. It is more important than ever to be aware of the signs of a stroke and to act quickly if you or someone you know experiences them. Remembering the acronym FAST can help you recognize the signs of a stroke and take appropriate action. If you or someone you know is experiencing any of the signs or symptoms of a stroke, call for emergency medical attention immediately. Time is of the essence when it comes to treating a stroke, and the sooner medical professionals can intervene, the better the chances for a full recovery. It is also important to be proactive about reducing your risk of a stroke. Maintaining a healthy lifestyle by eating a balanced diet, exercising regularly, and avoiding tobacco and excessive alcohol consumption can all help to reduce your risk. Additionally, managing any underlying medical conditions such as high blood pressure, high cholesterol, or diabetes can also help to lower your risk of a stroke. If you have a family history of stroke or have other risk factors such as being overweight or having a sedentary lifestyle, it is especially important to take steps to reduce your risk. Talk to your healthcare provider about ways to lower your risk of a stroke and develop a personalized plan for maintaining your health and wellness. In summary, strokes can have serious and long-lasting effects, but prompt medical attention and proactive risk reduction can help to minimize these effects and improve the chances of a full recovery. Knowing the signs and symptoms of a stroke, seeking medical attention right away, and taking steps to reduce your risk can all help to protect your brain health and overall well-being.